What are the symptoms and signs of mucormycosis? Well, mucormycosis could affect any part of the face, particularly the areas around the eye, nose, sinuses, and jaw. So, any person who has been afflicted with COVID and has had a prolonged course in the hospital as a result of this needs to watch out for any of these symptoms, which could be redness, pain and inflammation around the eye, pain behind the eye, a little bit of protrusion of the eye called proptosis, stuffiness in the nose, along with sometimes leading to the fungus affecting the upper jaw and hence causing loosening of the teeth or ulcers in the palate and the mouth. This progressive disease can spread through the sinuses into the jaw and also the areas around the eye. And if untreated or ignored, then in patients who already are immunocompromised, this could lead to even severe complications like neurosurgical problems in terms of invasion of this disease into the brain. So any patient having any of these symptoms needs to urgently see a team of doctors who deal with mucormycosis or fungal infections. At Avis, we have a team of doctors who consist of ENT surgeons, maxillofacial surgeon, ophthalmologist, and also intensivists and critical care doctors who are in a position to make a collective decision about the management of a patient and give them the best outcomes possible. How do we treat this condition? Well, based on the clinical situation and also following MRI scans and CT scans of the sinuses and the face, we first need to understand the extent of the disease. Once we are aware of how extensive the disease is, we then start going about treating this. Treatment of mucormycosis consists of a two-pronged methodology of surgical debridement on one hand, along with assisted medical antifungal treatment. So, this surgical debridement could consist of going into the area where the fungus is prevalent, and this could be done through endoscopic surgery using small cameras which could go into the nose and the sinuses and clean up the entire area. We could also use access from the side of the eye or below the eye to go into the area and remove the fungal infection in that area. Sometimes when we see that the extent of the disease is a lot, then it could even lead to removal of the jaw in order to prevent the fungal infection from moving to more critical areas like the eye or the brain. So, the surgical debridement of this fungal infection is the most important thing that needs to be done immediately when a person presents with mucormycosis. Along with this, we also give the patient a course of antifungal treatment, the most important of which is a drug called amphotericin. And these people and patients who have surgical debridement with mucormycosis and are in adjuvant therapy of amphotericin need close monitoring, because some of these drugs, antifungal drugs, could cause other medical complications like renal failure or liver failure and conditions like that. So this requires a concerted effort by a team of specialists and doctors, which involve the ENT surgeon, the maxillofacial surgeon, the ophthalmic surgeon, and also physician, pulmonologist, and critical care specialists who holistically look at the patient and give them the best outcomes. We have all these facilities and these specialists available at Avis Hospital with us, and any patient who presents to us with mucormycosis is dealt with in the best possible way with a multi-speciality approach to this problem to give them the best results.